Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk to you about making these bondable blocks. I've been showing you how we use them and everything so much, so I thought I'd better show you how we actually make the block. It's not difficult, and this is an old way, and you may have newer, better things now, but we started making them years ago out of just plain lab acrylic, and that worked fine. And we would bond that to the teeth, and it didn't bond all that tight. And when you get ready to take it off, let me show you how. Like if we had a tooth, and this was bonded on top of the tooth, like such, we would cut a groove through the bonding material. When you get close to the tooth, you can see it, the difference in it. And then you squeeze with a pair of pliers over here and over here, and you mash those together, and one of them will come off, and then you can kind of cut the other one, and it weakens it and usually pull it away. And this acrylic doesn't fill in and bond real tight on there, but it stays on. I've never had one of them come off that we put on like that. This is a pair of pliers up here, and now there's some fingers that reach in there and mash them, take them off, and then you can kind of smooth out the teeth and whatever you do to remove them. But let me get in here and showing you how to make the things. Now here's a case this got a deep bite, you see, and it comes way down over here. And so we've bonded these blocks like this on the back side, on both sides of the mouth. Now, it's possible, if you had somebody with a lot of pain in their jaw, and you brought their jaw to the front some, and had them bite down on some wax like that, or actually the acrylic, and stop, their jaw could stay there, and there'd be a lot of pressure in this part. But if you put it right up at the front, the pressure's here, and then back on the jaw joint, back in the back of the mouth, back here. And that's when the jaw doesn't like that. And some people, it just gives them all kind of a trouble, so you know what's wrong with them. But I'm just trying to show you how we made them now, and you might have a better way, I'm not sure. Now we look at the other side, and you see where we have moved the jaw, the bottom jaw forward here. It would have to go back to fit up underneath there. So by moving it this much distance, the condyle back in here, where the condyle was in the fossa, it would move it up here. And if you were hurting by pressing back here too hard, you get relief from it by just putting this in there. That's a fact. You just reposition the jaw, but then you got to do something with it, so you can't just go off and leave it like that. It might stop the pain, like some guy I went all the way to New York, and he at least learned that he had to bring the jaw forward. And what he did, he went in and crowned these teeth back in here to fill in that space so that they could eat up here. He didn't dawn on him to intrude the teeth, and he wouldn't have done any of these crowns or anything like that. So I hope you learn this as we go through these different cases. They all kind of combine, and they're kind of tied together. Excuse me here, and then erase that. And now let's go to the other side. It's the same thing over here. But anyway, we're going to bond some blocks back here, and we're going to open this bite like that. And then we take those off. We have to get some room for them. But just showing you how to make them. And here we take some etching material, and we are going in and etch the surface of the teeth. And you just kind of put a little of that acid on the surface of the teeth and wash it off and dry it and etch the teeth real good, just like you regular do. And now I'm pouring some just plain acrylic into this, and we'll put a good bit of it, and then we're going to put some liquid in it, and just kind of put enough in there to kind of make it solid, fairly solid. And here we'll take that powder, and put, this is the etching agent that we put on there, and here we put that on the cotton down in there to etch it, and then wash it and dry it. And now we're going to come in, and when you bond it, you don't have to wrap the tooth up. You can cut it off on the sides and just have it bonded across like that. And I had some, I know several years ago, I had some orthodontists that came to want to know how we got the things off. And it's pretty simple if you make them out of lab acrylic. I made some out of real good composite, and it took a half a day to get them out of there. All right, here we put a little liquid on the, you've etched and dried and everything. Put a little liquid on this acrylic in here, and we're drying this off. And when we get ready, we dry that. We take take a brush and some liquid and just put a little bit of acrylic on there tooth. Now we're bonding with acrylic on an etched surface, so we put that on the surface where it's real liquid, and soaks in good on there. And we put some Vaseline or something around it to keep them getting the stuff in between, or some wax, better say wax. And now we'll take this part. This is this little bowl with acrylic in. We're going to roll it out, and it's kind of magnified there now, and we get it out, and it's kind of solid, but we can work it with our hands. So we take it and mash it out in shape like this block we're going to bond it to. Now we paint a little liquid on it and a little on the tooth, and we push this thing down on the teeth right like this, and it'll come out of the side. So we take a number 12 barred Parker and just come down and kind of saw like, you just kind of jiggle it along, and you saw the acrylic off away from the teeth, and it leaves the bonding material on the teeth. So here we'll go in, and now we're cutting the other side off. And now we let this harden at that point, or you close tooth. You've got some Vaseline on these teeth up here, or something that keeps it from sticking to that. So if you stuck it to the teeth, you'd have a lot of problems there. But anyway, we mash the teeth down to the height we want, and now we'll let it harden good, and then we put it on the other side of the mouth. Now, this particular case, we're doing an open bite, and we've got this intruding arch wire. It would come off like this. You see, this comes out of here, and it comes in, and now it will go up like this. And when we squeeze it down, it tightens this loop, and it'll pick these teeth up in the front, but in here, but it has almost no effect on these teeth back here because the occlusion keeps it. Now this one can't rise up. You see, if you start to prise this will try to rise, but it can't do it. This one will go down a little bit, but then these don't touch when it goes down, so when they bite on it, it closes this up. And so you can keep these teeth almost like they were exactly while you elevate the upper teeth and bring the lower teeth down, and you won't open the vertical of this person's face one bit. Sometimes you close it in doing that. So it's making the block there's a lot more to it than just hardening a piece of acrylic between the teeth. So here we hardened it up, and we can come in and grind the edges, make it kind of smooth. Now when you get ready to do this, you take this off. You take this same burr and just cut a groove down in the middle of this and mash it together with a set of pliers or something, and you can pop one side off easy and the other side's kind of weakened, and you can work it and cut between them, and you got a different color. When you get close to the tooth, you can see it when you're grinding that off there. Okay, that's the end of this deal, but it's not the end of bonded blocks. I'm going to show you a few more cases now. So I hope we've covered how you bond it on. You do not, you got a tooth up here like this, and you got brackets and everything over on the sides of it like this. We just, when you first put it on there, it kind of folds out over like such, and you press down with the teeth, and now you take something and cut it off right like this, and then when you get ready to take it out, you go down like this, press it together, and it'll come off the teeth. But he says some marvelous things you can do with bonded blocks. You could take a person coming in to die and then TMJ problem, and if you bring their jaw forward and block it like that, then you put the force right between the teeth, and that person could feasibly be completely relieved of that. But then you've got to be able to take these teeth down and move this jaw together where it fits together in this forward position, and that's where the work comes in. See, there's a lot of ways of doing it. So bonding blocks is a neat thing, and if you just bond them on one side of the mouth, I will tell you in just a couple of months these teeth are touching over on the other side of the mouth. I think we've shown you some cases like that. So I'm going to sign off here. It's getting late, so I hope you've learned something from this, and join our little group and subscribe to our outfit, our web channel. So thank you for watching, and I hope you get something out of this, how to do this type of orthodontics. And I wish that it was taught in the schools so that people knew what to do and knew how to take care of problems they come up with the joints. So I'll see you later. Thank you now. Bye-bye.